Thank you for the opportunity, and I will be very brief. And it's been a long day. So my background is I am a physician by profession, and I am trained in genomics. So the topic that I want to bring in is in drug discovery, and I will briefly go over these variants. I see a combination of biotech physicians, so I will try to keep it very simple and get away from technical jargon. So why this is important and why this is where most of the world is looking forward, and how we are trying to use AI in defining these spaces. So first of all, I will go with what is loss of function, and then I will go in detail about some of the variants. So if you remember the central dogma, this is what all the biotech is about. This is where most of the science people know very well. It is straightforward DNA to RNA, RNA to protein. So whenever there is a change in a DNA, which leads to either change in the function or the structure of the protein, that change is called loss of function. And then these loss of function variants are almost whenever you have a disease, there are loss of function variants. And the sessions before me actually spoke a lot about cancer. So as a disclaimer, what I'm talking about is germline. Germline meaning these are the changes or we are born with, and cancer is called somatic, which happened over time because of wear and tear. So the cancer biology is little different, and this is mostly germline. So I will be talking about what we inherited. So when we are talking about, I am talking about loss of function variant. These are the variants that we inherited. These are the variants which may cause disease. Identifying them is of critical importance because I don't think there will be another aspirin or a statin which is going to come into the market in our lifetime. It is always going to be a targeted therapy where we are going to see, okay, you have this genetic change in your body, you are born with it. This is the reason you are having this disease. I am going to target this. I am going to cure the disease or keep it in control indefinitely. That is what the future is going to be. So let me go with us why this loss of function and this productive variants are important. So loss of function variants, almost every change in the DNA, 90 to 98% of the time, these are loss of function. So if you look at any genetic or genomics background, all the variants, nonsense mutation, frame shift, splice, this is all technical things, which means these are the changes which will lead to change in the protein which will not function. So these are the things that we encounter. Not everything will cause the disease, but these are the changes which are very important. When these are expressed, this will cause disease. So how will we know expression is a different topic for discussion altogether. So my point of interest is always the loss of function productive variant. So the speaker before me told about, okay, does every smoker develop a cancer? Not essentially. So for example, imagine you have a sample of some 20,000 patients or 20,000 people who smoked. And then you have around 1,000 or 2,000 of them developed cancer. Or maybe 50-50, say 50. 10,000 of them developed cancer, 10,000 of them did not develop cancer. And you have the genomic data and you know exactly you are following them for 5 to 10 years and you develop a database. And then you look back and see, okay, who are these guys? These were lucky fellows who smoked all their life but did not develop cancer. What is protecting them? They do have a change, but that is protecting them. If we catch hold of it, that is when the treatment for cancers can come. So that is the point I'm trying to drive, and I will give you some examples how this is done. So this is the loss of function protective variants. So right now, these are the, what do you call, the hot cakes that every pharma company is looking for. If you get this, it is a gold mine for any pharma company, that if you can prove that this is the variant which is a mutation, but people having this mutation are not developing the disease, that is when the pharma company can develop therapy within 2 years. They can devise a molecule and then target it and then come up with a medicine. So right now there are usually, it is very easy. Whatever medicine that you know existing are inhibitors. If you know a loss of function, you can inhibit it, and those are the medicines which are all the small molecules which we know of. Every tablet you take it from physician, it is an inhibitor. So it is a small molecule monoclonal antibody siRNA. Right now, there is an mad rush behind this PCSK9 loss of function variant, which is inclisiran. I think for cholesterol, they are doing it once or twice in a year infusion, which is going to keep their cholesterol under control and prevent the heart attack. So that is the first user case example of one gene having a loss of variant, which is protective. And then these are the things which will usually inhibit the target.